Hey everyone, I'm John Hammerly with the Plastic Surgery Channel. Today we're going to talk about a topic that hasn't been discussed a lot, and that has to do with something that goes on with some patients after their plastic surgery procedure, and that is they either get depressed or they get anxious, and it's sort of, shifting their mental health a little bit. Do you guys run into that?
Yeah, actually, it's pretty common, and I try to prepare patients typically that don't be surprised if you have some blue days a few days after the procedure. And I even relate to them. I had a cervical disc procedure, I don't know, 25, 30 years ago. But, incision here, they go down and they retract and, exchange the disc, and there's some nerve pain. And I remember about 6, 7 days after, I was just like, oh man, I am so sick of not feeling like my old self, and I thought, oh my God, I'm depressed, and I've never been depressed a day in my life, but I am. And I think, people's expectations, I don't know.
I think they're euphoric, maybe from all that cortisol and the anesthesia, and then it goes down. They're looking in the mirror and they're like, I want it all my symmetric
and swollen and bruised, yes. And all of that. And I think so. It's a normal phenomenon. It's a normal phenomenon. If somebody is really excessively depressed, then I think you need to get some help.
Definitely medication and
sure.
Talk to them about. I think it's great to pre-warn patients. I think that's super important.
Just so it's not a surprise when they experience it, and maybe they won't. You got to be careful with that sort of thing too, because it's almost like a self-fulfilling prophecy. Oh, you're going to feel a little depressed. Okay, I'm going to feel depressed.
Maybe there's a little postpartum set in where it's done, and I know when I finished a long running race, it's like, oh, okay, what's next?
Because you feel like the stars are going to align. So it's the carrot you're chasing, you get it, doesn't taste that good.
Right.
You're just like, so it's a little bit of that.
Or especially if you still physically feel bad.
Right, and you've paid a lot of money.
Yeah.
Mm-hmm. Well, and I tell you another thing though that can go with that is some maybe real depression over, I thought this was going to look like this, and I don't look like that, or right away. And so again, managing expectations, it's our most important job, right? And make sure, and a lot of times I'll say to a patient, look, if I'm concerned that we're not going to be able to make as much improvement as I think they want, I'll even say, look, if I can make this 50% better, is that good enough for you? And if at least it makes them aware that there's no guarantee here, right?
And that number's going to stick in their head, and afterward they're like, hey, yeah, I do look 50% better.
And sometimes I'll even say, look, this is never going to be as good as you and I wish it would be, okay? But, well, it's because I'm old and I've had a lot of time to develop these lines, right? But it's also what works. And again, what sticks, like you said, sticks in somebody's head. Just like telling them, your breasts, you brought me sisters, not twins. You're going home with sisters, not identical twins. I mean, all of that messaging and managing of expectations, I think, is a big part of what we do.
It's even harder now because of social media, because of checking everything on the internet that we do, and you have so many more questions to answer when they're back in the office, and I can see why patients might be a little blue because someone else had a better recovery.
If you'd like any more information about this or any other subject relating to plastic surgery, you're at the right spot, and this is where you need to come, theplasticsurgerychannel.com.